expected symptoms, what is it that we're gonna objectively, we're gonna observe objectively or subjectively receive? The mom, they're gonna have contraction, they're gonna feel pressure on their pelvics, right? They're gonna have cramps like period pain, but a little more bit more intense. They're gonna have diarrhea, they're gonna be having stomach pain, like upset stomach. They can have more contraction, like regular contraction that lasts about 10 minutes, and more frequent, it can last up to an hour or more, right? What else? They're gonna have their water break early, so that membrane is gonna rupture. They're gonna have their water break early if it's a case that they're in preterm labor. What are some tests? What are some tests that we're gonna go ahead to do to find out if this mom is at risk for preterm labor? We're gonna do the FN, which is the fetal fibro netic, something like that. Do a cervical culture, and this can test for infection. And if it's a case that we note infection, what we're gonna do is we're gonna go ahead to treat that infection. What else? We're gonna do a UA, and we're gonna still monitor for infection. Now that we've covered the risk, the expected symptoms, the lab tests, we're gonna go into what are we gonna do as nurses, patient care. What are we gonna do to the patient? What is the goal, not of only us but of the patient? The goal is to stop contraction. So we want to stop contraction. We're gonna tell the mom, hey, you need to be on bed rest. Put your legs up, relax, whether it be on your couch. You're gonna be resting, not a lot of activity. We're gonna limit it. We're gonna limit activity, right? What else? We're gonna continue to monitor the mom for any signs of infection. We're gonna check discharge. If the mom is having discharge, we're gonna check the color, and we're gonna check the smell of that discharge, and we're gonna watch for symptoms such as the yellow test equals blue, and the green, we're gonna rehydrate this mom. The mom is dehydrated. They have been maybe having diarrhea, and through diarrhea you can be dehydrated, and upset stomach. So we're gonna try to rehydrate this mom, push fluids. Yeah, I hope this helped, because I'm teaching myself while teaching you guys.